surface is convex. Okay, you can see it is convex. The posterior surface is flat. Okay, so it is the anterior surface and this is the posterior surface. And this is the hilum. So this is the medial border and this is the lateral border. And this structure is ureter. Ureter starts from the hilum of the kidney, goes vertically downwards without twisting. Okay, we should hold without twisting. If we hold it in this position, you can say the ureter gets twisting here, right? It should not be like this. So it is the kidney of right side. How to hold it? The upper pole is closer to the midline and lower pole away from midline. Right kidney is slightly below. So this is the anatomical position of kidney. Okay. This is right kidney. This is the hilum. What is the relation of the hilum? In front, it is the renal vein. Okay, this one renal vein, this one renal artery, and this is ureter, renal pelvis.
Which one is renal vein? Just go left side.
When I hold it like this, in front renal vein, middle renal artery, and posteriorly renal pelvis. Ureter, it is the part of the renal pelvis. It is the part of the ureter. How much ureter is called renal pelvis? The portion that up to the lower pole of the kidney. This portion is called renal pelvis. Okay. It is a part of the ureter, but it is dilated. That's why it is called renal pelvis. So this is the right kidney. Which are the left kidney? See, this is the left kidney. How to hold it? You can see this is the anterior surface convex, and this is the posterior surface flat. Okay, this is the hilum. This is the renal artery. This is the ureter. So ureter should be vertically downwards without twisting. And this is the left kidney and this is the right kidney.
Above.
Okay. So this is the single kidney, right and left. Now, what about that paired? At first, you should get the ureter not twisting.
Non-twisting some and like a simple one side right and one side left.
It's difficult, kind of difficult. Now, here you can see. Here you can see here, okay. This is the inferior vena cava on the right side. This is the inferior vena cava, it is collapsed, okay. And this is the aorta, it is not collapsed, okay. The thick lumen. On the left side, it is aorta. On the right side, this is inferior vena cava. So this is the right kidney and this is the left kidney, okay. You can see from the inferior vena cava, renal vein directly goes to the kidney, okay. This is the renal vein. The left renal vein is longer, right renal vein is shorter, okay. And in the upper pole, this one is the suprarenal gland. It is attached with the upper pole of the kidney. This is the suprarenal gland, okay. This is the suprarenal, left suprarenal gland. It is attached with the upper pole. So how to hold it? You have to hold it like this. See lower. So this is the anatomical position of the both kidney with aorta and inferior vena cava.
Now you have to show the right slightly below and left slightly above.
Yes.
How could you please hold it? Which one is aorta?
Which one is aorta?
On the left side it is aorta. On the right side it is inferior vena cava. Because inferior vena cava drains to the right heart and arch of aorta arising from the left ventricle. Okay. And these are the dissecting portion of the kidneys. Okay. It is dissected longitudinally. Okay. This is the suprarenal gland. Suprarenal gland. This is the renal pelvis. Okay, renal pelvis opens into the renal sinus. This area is called renal sinus. Renal sinus formed by the union of 2 to 3 major calyx. You cannot see the major calyx here. Okay, from here it arising the major calyx. Then major calyx arise from the pointed portion of the pyramid, that is called the minor calyx or minor papilla. Okay, so minor calyx form the major calyx, all the major calyx togetherly form renal sinus, and renal sinus ultimately drain into the renal pelvis. So these are the macroscopic structure. This is renal medulla and this one renal cortex. Periphery renal cortex, center renal medulla. Okay, these are the pyramids. You can see these are the pyramids. Okay, pyramids present in the renal medulla. In the model you can see more clearly. So these are the all structure about kidney. Acha, what are the relation of the anterior surface? You have to know what right side. On the right side, above suprarenal gland, then most of the portion is liver. On the medial side, duodenum. Here will be the right colic flexor or hepatic flexor, and some part jejunum. Okay, so this is the right relation of the right kidney. What is the relation of the left kidney? Above suprarenal gland, here will be the relation of here gastric impression, here will be the splenic impression, here pancreatic impression, here left colic flexor, here jejunal impression. Okay, so these are the impression of anterior surface. The posterior surface, both kidney has same relation. On the right side, above diaphragm, ribs, 1 rib. On the left side, diaphragm, 2 ribs. Okay, 11th and 12th. Then 3 muscles and some nerve and vessels.
What? Show the like muscles and all like.
No, just like this. So these are the relation of the kidney. Okay. Now practice yours. Is it not?
Ma'am, please repeat one.
Right and left. Okay, this is the abdominal aorta. Okay, the terminal branching are right common iliac, left common iliac. Right common iliac again divided into internal iliac, external iliac, internal iliac, external iliac. Okay, and this is the inferior vena cava formed by the joining of the right and left common iliac vein. Okay, so this is the inferior vena cava.